Welcome to the first episode of Fox Takes, where I, Jeremy Fox, a licensed therapist, address some questions or posts that I see on Reddit. I'm really excited to get into this today because hopefully some stuff that I share will help to alleviate some misconceptions about therapy. So let's jump right in here with this Reddit post by Carly the Memer. Why do crisis counselors all say the exact same stuff? Maybe it's just me, but every time I've ever tried to text a crisis text line, every single time, they have said the exact same thing, and it's never actually helpful. They always tell me that it's not as bad as I think. I'm a good person. We should make a safety plan, blah, blah, blah. Like, I get they're trying to make me feel better, and it's not like they can agree with me that I'm the worst person ever to exist. But I feel like they just say that because they're supposed to, and they don't actually offer any real advice. They never see it objectively, like a human being would. It feels so fake to me. Okay, so now I'm going to jump into my response here. Because I've actually heard this before from my in-person clients. And so let me just be clear here. Online crisis worker therapists are volunteers on text lines, or the crisis phone lines people are usually, to my understanding, not licensed therapists and can offer the heavy-duty effective psychotherapies that are beneficial in permanently reprocessing and eliminating traumatic memories. So you can't expect that to be delivered over a text line or over a crisis phone line. And I believe that those individuals are trained pretty extensively in not giving in to clients' negative thoughts. So just imagine that you have a therapist with you in a therapist's office, and they can engage in a more helpful conversation about targeting your innate negative beliefs, those internalized negative cognitions. And they can do so knowing that you're right there, safe, without having to be concerned that you could go grab a weapon nearby. So just for anyone out there to alleviate that misconception about those lines, they're what they sound like. They're crisis lines. They're not usually going to be extensive or psychotherapeutic. And for that, you usually need to meet with a therapist. And so my response was to type that online crisis workers usually don't offer those heavy-duty therapies, and that if you want more than that, it's a good idea to seek out EMDR, eye movement desensitization and reprocessing, a therapy that I often reference, that I do with my own clients, because it allows you to go down the rabbit hole of your own psyche and permanently resolve traumatic memories and reactions. So it allows you to, at your nervous system, rewire your responses to traumatic memories, to cues or triggers commonly known in your environment that cause you to enter patterns of behavior that you typically enter when you're in a traumatic flashback or way of behaving. So a flashback can cause you to believe you're in an event, in other words, and you behave the way that you would feel in that event. So EMDR and therapies like that help you to reduce the chance that you'll enter a flashback and reintegrate the content that your brain keeps giving back to you in a flashback or dream form. So, and there are ways that it works. It's a very fascinating therapy, and I'll probably get to exactly how it works in an upcoming video. The next post is titled, Dreaming About My Therapist. I'm a male, 20 years old, and have been with my therapist for over a year now, and sometimes I dream about her. One of my recent dreams was very weird. I'll explain. I had an appointment and ended up in the session room where we talk, although it looked very different. Then next thing, she gets ill and looks sick and exhausted, and I get worried and try to comfort her. Then for some weird reason, my grandma is there and is saying repeatedly, "Are you okay?" And I tell her to stop asking and go away, since she's exhausted, my therapist. This is as much as I can remember right now. I want to tell my therapist, but I feel like this is a weird dream and scared I'm gonna get terminated or something. Should I tell her? Most importantly, you should never be terminated for sharing dreams with a therapist. That would be completely unethical and also extremely unlikely. That's the first thing that I'd like to get to my listeners and to this poster. In my response, I shared that. A therapist is there to be your sounding board and talk about the difficult, uncomfortable subject matter that someone out in your daily life wouldn't. So next, a bit of psychology history. Sigmund Freud is widely considered the father of modern psychology, and also, particularly, of psychotherapy, which we know is counseling. He attributed a lot of significance to dreams, even calling them the royal road to the unconscious, meaning a path to our inner workings and ideals. Your dream seems to illustrate, so this speaker's dream seems to illustrate an unconscious fear of exhausting his therapist, of being too hard or too much to handle. And that could be an important thread for our poster to follow with his therapist. His grandmother may represent an internalized caretaker figure or an extension of his own empathy, which attempts to heal the exhausted therapist. And the dream would be a great clinical topic of exploration. How do I tell my therapist things without him thinking I'm wasting his time? Okay, we're already off to a difficult start here. The post goes on to say, the problem is that none of my problems are real problems. I haven't been abused or assaulted or hurt. I just hate my life and want to die. But only sometimes, and for really stupid reasons. I don't have any real problems, but I'm just never happy, ever. Everything feels like I'm Sisyphus pushing up that rock over and over again, just for it to fall back down. I think my therapist thinks I'm just wasting his time, or that I'm just lonely and need someone to talk to. There's so much that's wrong with me, but none of it really warrants therapy. I'm unpleasant, my personality sucks, I have no friends, I'm desperate and annoying, which is just off-putting. I always want things my way, and I don't realize it, but I'm manipulative, and I always try to pretend like I know all about something when I don't. I'm unladylike, and I have a potty mouth. Nobody likes me. I feel disgusting, like actually dirty and gross. Whenever I think of anything sexual, I feel disgusted with myself. Why? Sex is normal, I know that. And I think everyone hates me. See, it's like some sort of pathetic high schooler's inner dialogue, and none of it is actually important. I can just get over it, right? How do I tell him this stuff without him thinking I'm an idiot who's wasting his time? How do you even start this conversation or bring these things up? All right, there's much to cover here. First of all, if someone has these kinds of feelings of complete ineptitude and inadequacy, I think therapy is in order, to put it mildly, and I think it's deserved. So how do you bring up this kind of conversation? Well, I would say again, much like my last comments on a previous post, a therapist is there to be a sounding board and is there to appropriately respond to clients' spur of the moment and stream of consciousness thoughts. Freud himself encouraged clients to lay on a couch and say the first things that came to mind. This is how psychotherapy got its start. And in that respect, it's very similar now. You have the right as a client, whether it's your insurance or out of your pocket or both, a combination. You're paying for this person to be a medical and psychological professional. And so you have the right to ask questions and things that maybe you wouldn't at a dinner party with strangers. Bringing up the fact that you feel that it's unearned, the attention you're receiving, and how the clinical expertise of this individual could go elsewhere. That would be a great place to start. And I'm sure that the therapist has heard this before. I know in my own practice, I've had clients voice that fear of wasting time, of not deserving their space in the chair. And I always go back to, where did you first feel that way in life? This individual, this Reddit poster, is describing situations where there's a profound feeling of inadequacy, of inferiority, and of feeling the need to put on a certain front and pretend to know things when this person doesn't. So even the beginning sort of salvo of comments here of comparing oneself to the myth of Sisyphus, of pushing the rock up the hill, is extremely well read, and this client has a great deal of intelligence, I can tell, and that can be mobilized quite well. Feeling a sort of, we could say, inevitability of suffering or of pointlessness is perfectly natural in life and something that we therapists deal with very often. And so the question of where to begin really lies in, how do you want to approach this with the therapist? I would say to open up a session with this so that you allow yourself the full clinical time to explore it and investigate. Do some personal archaeology on when you first felt these sort of sensations of not being worth time or attention, because that will go somewhere extremely valuable, and it will allow you to tug at these threads of personality development. Because if you feel that your personality sucks and you're manipulative, even unwittingly, then there may very well be some dependent personality traits or borderline personality traits. Notice, I'm not saying disorder. There are some subclinical expressions of these disorders in ways that don't meet full criteria for the disorders themselves, but it doesn't hurt to explore how these foundations, these islands of personality traits, evolve in life due to various different stressors that cause certain mountains to come up and certain valleys to form. Here we have a post beginning, male 17, feeling of detachment. Here's the too long didn't read version. I'm experiencing some sort of weird, mild psychosis. Zoning out, not doing proper social routines, crushing loneliness, and the ability to focus on only one thing. It could be down to caffeine, 2 cups a day, veganism. I take 1,000 milligrams of B12 per day, as well as a vegan oral spray with loads of stuff, including iron. Marijuana use, once per week for 3 months, although I stopped a month ago. Lack of sleep, 6 to 9 hours per night, always. Sadness, not diagnosed with any mental illness at the moment. Lack of exercise, I'm very active though. So it started probably 12 months ago when I lost the ability to recall names as well. I forgot my coworker's name, who I work with once a week, every week. Since then, I have trouble remembering what I have told people and what they have told me in the past. I went vegan with vitamin supplements about 4 months ago. Around that time, I started smoking cannabis once per week for fun and to reduce my anxiousness a little when starting the week. At the moment I'm writing this, and each time I look away from my phone, I forget it's even there. And when I look back at my phone, I lose concentration of the room around me. These days I have episodes of sadness for a few days up to 2 weeks at a time. And I could have some kind of anxiety, although I'm decent at focusing on anything else except what's happening around me, which helps a lot in stressful situations. I'm at the point of choosing universities and deciding my future, so stress could be a factor. I haven't got any genetic history of depression, autism, or anemia, although my aunt has MS. I'd love for anyone to offer any advice about how to clear my brain fog, clearly meant brain fog, whether that is to move away, go on a huge holiday, drop out of school, quit my weekend job, get another job for evenings, smoke more weed, smoke no weed ever again, stop drinking caffeine, sleep more, sleep less, etc., etc. Honestly, I have no idea what it could be, and I'm too scared to change too much in case I have a really bad episode or something. Thank you so much for reading. My first thoughts would be that some attentional issues here may be due to anxiety and elevated heart rate and not encoding memories properly. If someone tells us something or we learn new information like a name and we're not in a receptive state of mind and we're distracted, we're not going to encode that information in the first place. Have you ever possibly been zoning out sometime and then didn't remember what happened while you were focused inward? That may be very well what's happening here with our poster. It's also possible that maybe he needs to see a nutritionist to ensure that he's getting appropriate amounts of protein. It seems like he's very invested in his intake and nutrition, his consumption already, as he's given us what information regarding his iron intake, B12, which we know is a very important vitamin. So I would encourage, though, to really seek medical professional beyond just a psychologist or even a psychiatrist, and into a nutritionist and a medical doctor who specializes not simply in psychiatry as a psychiatrist and medical doctor who just does primarily psychiatric stuff, but someone who maybe has a specialty in nutrition on a medical front and on just a nutritionist front as well. And it's also a good idea to speak to a mental health professional to determine if there's been any trauma. A big term we use in the therapeutic community is dissociation. So we know that when someone's been through a traumatic event, they may have a tendency from then on as an unconscious and rapid response to dissociate, to go outside of the present consciousness in their mind and be focused elsewhere, to feel like they're floating and unable to really connect with the moment. Now, I'm not saying that's what's happening here, and it's potentially not, because we're given no reason to think so, but it's always a good rule out. And of course, as we see in many of the comments from this post, ADHD is a definite possibility, and it could cause those sorts of memory difficulties, forgetfulness, the flights of attention, the inability to really focus. What this isn't, though, and the poster may not be familiar with the term, is psychosis. This is not psychosis. Nothing here gives me the indication that this person is experiencing delusions, so thoughts that are untrue and often bizarre, or hallucinations, which we know, auditory, visual, olfactory of the nose, gustatory of taste. None of those sort of hallucinations are here. So what we're dealing with is some sort of deviation in attention that's either based on an encoding factor of not paying attention when listening, or retrieval, so maybe distraction or high levels of anxiety when attempting to remember or retrieve the memory, or potentially a mixture of the two. Good news is that this poster sounds extremely insightful, especially for 17, and with the proper nutrition and medical information should definitely be able to quell whatever attentional issues are causing these memory gaps. In concluding this inaugural edition of Fox Takes, I just want to encourage everyone out there to be safe. As of my recording, it's mid-March here in 2020. It's the 15th, in fact, right here in the middle of the month. Take precautions that are necessary to stay healthy whenever you can. Engage in healthy hygiene. Be aware that panic itself can cause symptoms of shortness of breath. Anxiety does that. Stay safe and stay clever.